All right, that was awesome. All right, guys, here we go, kicking into the afternoon. It's getting late, so we're going to move kind of quick. Gunshots, hearing loss, and suppressors, the science behind hearing protection. Joining us now is Hayes Wanamaker. Now, I'm going to do this intentionally because I can't help myself. I did go to college, and I know I can read. Board certified otolaryngologist and associate director of Doctors for Responsible Gun Ownerships of America, an organization I've worked with for a long time. So my question, Hayes, is before we get started is, can't you guys just go like with ogologist or something?
How about just DNT?
ENT works good for me. Okay. Hayes, take it away. The
Thank
clock is yours, and you
Thank
can
you.
tell the clock right there. Thank you, doctor. Appreciate it.
Or for me, I'm just an ear doc. So that works. Very grateful for the opportunity to speak to you all this afternoon on behalf of my colleagues at Doctors for Responsible Gun Ownership. Now, don't let that name fool you because our idea of responsible gun ownership is a little bit different than you might typically hear. Um, I was really excited to get the invitation to speak, and then I looked at the list of featured speakers, and it's a who's who, and I'm a sort of a who's he. So let me just adjust that a little bit. I've been very blessed to have a 35-year career as an ear surgeon and a lot of wonderful opportunities along the way. A few years ago, Tim Wheeler, who's also an ENT and founded DRGO, encouraged me to get involved, and he and and our director Rob Young, who's also here, took me under their wing and have been bringing me along to be part of the group. I'm also one of the co-authors of the American Academy of Otolaryngology Head and Neck Surgery position paper that we recently came out with on suppressors and the importance in preserving hearing. I'm also a certified range safety officer and a volunteer instructor. And like many of you in this room, I have high frequency sensory neural hearing loss and tinnitus. And I live in one of those hateful eight band states where protecting my hearing is a felony. So this isn't just professional for me, it's personal. So this could be a really long talk and I have 15 minutes. So I'm going to move kind of quickly. I'm going to summarize, I'm going to simplify, and I hope you guys are okay with that. You're born with the best hearing that you are ever going to have. Noise-induced hearing loss is cumulative and permanent. After injury, you may have some recovery at milder levels, but you're not going to have repair, regrowth, or regeneration. Noise-induced hearing loss affects not just hearing, but also understanding, and it may cause tinnitus. Suppressors are effective because they reduce the sound at the source, and those benefits are additive with ear level protection. As you know, they don't silence gunshots. What they do is that they reduce the damage from definite damage to tolerable trauma. And they're really, as such, a preventive health tool. So just a quick review of how we hear. Sound energy is mechanical energy. Hearing is an electrical signal. So that translation has to happen, and it happens in the ear. So sound waves come in the ear canal, hit the eardrum vibrates, makes the hammer, the anvil, and the stirrup vibrate, and that makes the fluid in the inner ear set up fluid waves. And when that fluid moves, it shifts the membranes in the inner ear and causes the hearing receptors to fire, and they're really the transducers, and they send an electrical signal along a hearing nerve to the brain. And if we zoom in a little bit, that little blue membrane is the membrane that shifts with the fluid waves, and the tips of those little hearing receptors or inner hair cells are what send the hearing electrical impulses to the brain. There's also an outgoing pathway that's regulatory that helps control some of the higher level functions of hearing, and we'll talk about that in a little bit. Now, because sound is a mechanical energy, if it's powerful enough, it can really damage the hearing in two ways. Well, really three. It can be, if it's severe enough, it can cause a severe concussion or a shock wave that immediately damages those hearing receptors. Less intense energy causes a lesser degree of damage, but those hearing cells, hearing receptors gradually deteriorate and die. And you can see the difference between a nice, healthy population of those hearing receptors and what they look like when they're damaged. And if we zoom out on a larger level, you can see nice, orderly structure, normal population, normal organization. And then as the structures are damaged from noise, the structure breaks down and you have damage, but also lots of areas where the hearing receptors are actually missing. Now, the third way is if it's loud enough, it can actually bypass the ear, including your ear pro, and go through what's called bone conduction, and the sound goes directly through the vibrations of the skull and can damage the ear that way. So at a milder level of injury, you get what's called temporary threshold shift. And if you've been to the range for a long period of time, or maybe front row of an AC/DC concert when you were young and foolish, you would have that sense walking out of muffled sound, ringing, roaring. You may even have pain. And those are hearing receptors that are injured but not destroyed. It's essentially a mild inner ear concussion. But noise-induced hearing loss is a more severe level. Similar symptoms, but more severe. And the hearing receptors and the regulatory system also are permanently damaged. And there's no recovery from that. And you may actually have progression. So if you look at that graph with temporary threshold shift, immediately afterwards, your hearing is at its worst and gradually recovers. With the permanent damage, the hearing loss may initially be mild, but then gradually worsens. So if you go to your audiologist or your ear doctor, they may do an audiogram and you get a graph that looks like this. Noise-induced hearing loss, for reasons that have to do with the structure of the inner ear, the damage is most severe and the ear is most susceptible at 4,000 cycles per second or 4,000 hertz. And then with more severe injury and more duration of injury, that loss not only moves down, causing a loss of hearing acuity, but it also spreads to a wider range of frequencies. So what happens? Because it's the higher frequencies that are affected, the consonants live there. So they're the areas of speech that are most likely affected. So you start losing your T's, your S's, your F's. And what happens is your ability to tell words apart that sound similar begins to deteriorate. You also lose the ability to hear softer speech. You may have trouble hearing in background noise because of those higher level functions like filtering start to deteriorate, and you have difficulty picking out a specific speaker. And you may also get sensitivity to loud sounds. Now, having said that, if you go home to your significant other and say that your selective hearing loss is because you've been to the range and not because you're not listening or not paying attention, you're on your own on that one. So tinnitus. Tinnitus actually is complicated, but I think an easy way to think about it is because that regulatory mechanism and the supporting cells are more susceptible to noise-induced damage than the hearing receptors themselves, you can get areas where the hearing receptors are functional, but the regulatory mechanism is not. And the hearing receptors will start spontaneously firing. You basically get a spontaneous electrical discharge in the ear, even though there's not really a sound. And that information goes along the hearing nerve to the brain, they're just doing what they're supposed to do. And so there's nothing physically dangerous or harmful about it, but it can be at best annoying and at worst psychologically very disturbing. But again, that is just another function, another aspect of noise-induced hearing loss. You guys have all seen graphs like this. Just one thing I want to mention is that loudness is measured in decibels, which is a log scale. So if we say a sound is 10 decibels louder, or you have a 10 decibel hearing loss, that doesn't mean it's 10%. A 10 decibel change is really 10 times the magnitude, 10 times the intensity. 20 decibels is 100, 30 decibels is 1,000. So you look at the graph, and the graph doesn't look that bad, but it's really much more significant than that. So gunshots, unsuppressed gunshots are really, really, really loud. Suppressed gunshots are just really loud. And Hollywood gunshots are just bullcrap. But what the suppressors do is they shift that level down from an intensity that's going to cause immediate damage to a level that's more like a temporary threshold shift. Now, with repeated exposure, you can induce more severe damage, but it really lowers the risk. And that's why they're so important. So as I said, they reduce the level from permanent damage to a temporary threshold shift. And I'm preaching to the choir here, you know, they allow environmental and situational awareness. They protect against unexpected discharges. It mitigates amplified sound indoors at the range, or God forbid, in your house. And it reduces the risk of repeated discharges, or repeated injury from repeated discharges. There's also the good neighbor effect with people that live near a range. But from our perspective as ear docs, they're a preventive health tool. They prevent damage to our sense of hearing. And because of that, we really felt like when it comes to the battle to get suppressors legalized, that preventive health piece was a very important piece of the fight. And so about a year ago, Tim Wheeler got a bunch of us together, and we went to our academy, and the American Academy of Otolaryngology is the medical specialty that's really charged with hearing healthcare. And we thought it was important to have a proactive statement from them that suppressors are critical for preventing hearing loss. It wasn't a political statement, and it wasn't tied to any particular piece of legislation. It was a preventive health statement from the docs who know best about it. But a really key piece of us getting that approved was that bolded statement from a CDC report. Now, CDC is not known for its pro-Second Amendment advocacy, but that was the truth, and it was reality, and that was a very compelling piece of the puzzle for us to be able to get that through. And as I think some of you know, that got picked up by our friends on YouTube, our friends in the 2A press, litigation, legislation, and so we were very gratified to see it used in the way in which we intended. Have a little bit of time left. I just want to talk a little bit about DRGO. It's been in the fight with you guys since 93 or 94 when Tim Wheeler started it. It was originally affiliated with the Claremont Institute, but then in the Obama administration, it found a home here at the Second Amendment Foundation, and they've had us under their umbrella and supported us ever since. Our advocacy and our information is certainly not limited to hearing loss and suppressors. Strongly encourage you to go to our website. There's a wealth of information, a wealth of resources there about a wide range of topics related to the Second Amendment and to health. You know, our mission is really fighting the bias and the misinformation and the propaganda that we unfortunately see not just from the gun control lobby, but from many of our healthcare colleagues. I would also encourage you to follow us on X. Dr. Tim still runs our X account. He actually just put up one today. They're timely, they're informative, and they're usually pretty entertaining. Got some QR codes there linking to our website. to the comprehensive white paper on suppressors, which is what gave rise to our advocacy statement that was put out in 2017. And then a link to that Academy statement itself. So if you have healthcare professionals in your family that are Pro-2A people, please have them join. It's a one-time thing. We're just looking for support. And we are here for you. Talk to us here. Contact us on our website. Contact us on X. And thank you very much for the opportunity to speak to you. Remember, protecting your hearing should not be a crime. Thank you.